Hi, everyone. Welcome to our genetic counseling meeting. I am Dr. Lee.
And I'm Dr. Mack, and today we have two wonderful newlyweds joining us today. Would you like to please describe yourself?
Of course, of course. Hello, Dr. Mack and Dr. Lee. How are you guys doing this evening?
We're doing amazing, thank you.
That's great, that's great. Okay, so I am Raphael. I'm 31-year-old female, and my husband is Chase. He's a 21-year-old male, and we are planning to have a baby. However, I'm a carrier of Duchenne muscular dystrophy, and I was wondering how our children are going to be affected.
So that's a great question. So first, let's go through a general background of the disease. So Duchenne muscular dystrophy is caused by genetic problems in producing dystrophin, which is a protein that protects muscle fibers from breaking down when exposed to enzymes. And this disease is inherited in an X-linked recessive pattern with a gene mutation on the X chromosome. And some symptoms of this disease is that it causes progressive muscle degeneration and weakness. So most of the time, people that are affected by this disease don't live very long.
Mm, mm,
So what's the prognosis of this disease? Like I mentioned earlier, is not very good. By 12 years old, patients are often wheelchair dependent, and by 20, or even as early as the teenage years, death can occur as a result of respiratory or cardiac complications. And unfortunately, there's no cure for this disease. Some medicines, such as corticosteroids, can improve muscle strength and function for up to 2 years, but death is still inevitable.
mm. Can you guys show like a diagram?
Okay, so basically, as the mother has a recessive gene and the father doesn't have the carrier at all, there's actually a 0% chance of having a female baby that has the disorder. While for males, if you have a male child, you'll actually have a 50% chance for the male to have the disease. So
Oh,
actually, the percentage is kind of low, but it is still like a risk factor.
oh
Do
wow. Do you guys have
you
any
guys have any
recommendations?
recommendations?
Yes, please. We really need them.
Okay, so our recommendation, if you do not want your child to have the disorder, there's like a definite way to do it. It's called IVF. So you can do in vitro fertilization. This procedure will consist of retrieving the mother's egg and the father's sperm, and then they'll analyze it to make sure that the DNA doesn't have any disorders, and then it'll be combined and then transferred to the mother's uterus after. So in the end, the baby will not have the disease and will not be a carrier either. And then both your and the child's quality of life will be better and you will save money. But remember that IVF can cost around from 15,000 to 40,000.
Oof.
And
Okay.
then the next recommendation we have, if you end up having the child with the condition, they can go to a physical or occupational therapist. So we recommend that the child is started on this as soon as possible. The physical therapist would help your child improve their movements. The occupational therapist would help your child maintain the skills that they learned. And
Mm,
these will actually control the symptoms and improve the child's quality of life. It'll strengthen their muscles and it'll help them relearn and perform actions they might forget or might be changed by the muscular dystrophy. And remember that it's not curable, but these specialists can really help your child adjust and make their quality of life better.
mm. Okay.
And then the last one is treatments. And as I said, this disorder is not curable, but there's treatments that can help manage them. And earlier, as Ella said, you can use corticosteroids, which are a type of steroids. They'll slow down the muscle damage and the weakness caused by the disorder, and then they'll also help the lung and the heart muscles function better. And again, your child will have a better quality of life, but will not be cured.
Mm. Okay.
Is there any way to make sure my child does not get the disease?
That's a great question. So, like mentioned earlier, you can do in vitro fertilization, but it's very expensive. So if you don't have the money, then it would be very hard to do. So basically, what happens would be that a sperm and egg will be taken from the parents, which will then be fertilized in a lab into an embryo. And scientists will test the early embryos for the disease, or if they have the gene for Duchenne muscular dystrophy. And if you find any embryos that don't have the disease, they'll implant the unaffected embryo into the mother's womb. But remember that this procedure costs a lot of money.
Okay, that's great, but if my child does have the disease, I'm not gonna lie, should I abort?
Okay, so this is a very serious matter and it's up to you and your beliefs. We can give you information. So Duchenne muscular dystrophy is a fatal condition with a life expectancy of only 16 to 20 years. And people who suffer from this disease will often experience pain and will most likely suffer throughout their life. But on the other side, abortion may harm future childbearing and pregnancy outcomes, and abortion pills also cost a lot of money. So the pills cost $700 and the surgery costs around $1,500. So it's not nearly as much as in vitro fertilization, but it still costs a lot of money. And we cannot make this decision for you, but we can give you advice and information.
Oh, okay. I see. That's pretty expensive. We're tight on money. How much money would treatment cost?
So treatment costs a lot of money, and the annual cost of treatment on average is $75,000, which is quite a lot of money. And medication and tests by themselves cost up to $5,000, and this is only per year. And the total cost of living with the disease can amount up to $120,000, which is a lot of money. And through these treatments, the medication still will only prolong the patient's life for 2 to 3 years. And even with treatments, you can only spend 25 years with your child at most.
Thank you. Thank you.
Hmm.
So if you guys want any more information, then you can visit these websites. They are very good and they provide good information.
Okay, okay.
Okay,
Thank you so
thank
much,
you.
Dr. Lee and Dr. Mac. We really appreciate it.
Yes, thank you. Thank you.
Yes, thank you for coming to our meeting. I hope that you guys gained a lot of information, and then you guys can see us again if you have any more questions or if we need to go through more information.
Okay, thank you.
All right. Thank you.
Thank you.